deserves it, but I also want to point out that it's begun to work. 5,883 uninsured kids in Allegheny County is too high. We want that number to be 0, Z-E-R-O, but 2% is moving in the right direction. Pennsylvania is at 5%. The reason I line that up, not just to compare the state to the county, is that there are differences. Why is it that we're at 10 in Allegheny County with adults and 2 with kids? Because we've concentrated on children, thank God. We still have to concentrate on them in this bill. We'll walk through some of that. Pennsylvania, why is it 12 versus 5? Because we concentrated on kids. We got to do the same thing for the ages of 19 to 64. A lot of middle-class families in there. A lot of them employed and still not getting the coverage that I believe they should have the right to expect. So let me go to the next one. I won't dwell on this, but because if I do, I'll get madder and madder and madder. This is an abomination. This is an embarrassment to America that insurance companies are permitted to deny you coverage for pre-existing conditions. So for pre-existing condition denials, for exorbitant out-of-pocket costs, for preventive care where they kill you with costs, those at least the first 2. The second and the third one gets a little complicated, so you have to pay some, but limiting that is some. But especially number 1, that should be illegal in the United States of America. Spend every moment doing the bill, but I'll tell you, this debate has not been about what is in the bill. Okay, so it's important to point out that on page 8, the very first section of the bill reads as follows. And you know, they say, oh, these bills are complicated and we can't understand. You can understand this question pretty easily. It's real simple. Page 8, well, let me forget pages. 2705 is a section. First sentence in that section, a group health plan and a health insurance issuer offering group or individual health insurance coverage may not impose any pre-existing condition exclusion with respect to such plan or coverage. That should be the law of the land. And folks, it is not now. So they can discriminate against you no matter how rich you are, no matter what insurance plan you have, unless you've negotiated something that no one else has been able to negotiate. They can deny you and your family coverage for some pre-existing condition. I'll tell you more detail about it later. It's really bad, and we should stop that in its tracks once and for all. Let's stop talking about it and crying about it and complaining about it and do something about it this year. Make that illegal. We're going to do that, okay? Let's go to the next slide. There's too much to cover. No dropping of coverage for those who are seriously ill. They can prevent you from getting enrolled if you're seriously ill. And then once you have coverage, you think you're feeling pretty good, you got coverage, you're paying your premiums, and they can still drop your coverage because you're seriously ill. That should be illegal. So should gender discrimination. Why should they discriminate against women because of their gender? That's happening in America today because insurance companies have power that we accept. We should no longer accept this disparity of power. You want to talk about control over your lives and your health care? Start with insurance companies, and there's some examples. Let me go to the next one. We can talk about a lot. Lifetime tax is outrageous. I won't get into that, I'm sure. The hidden tax. We hear a lot about if we cover these 60 or 50, some people think it's 52, roughly 50 million Americans without health insurance. If I have insurance, my insurance is going to be, I'm going to pay more to cover those folks. Well, the fact of the matter is, today, each and every one of you, if you have insurance, is paying today $1,000 nationally is the estimate. Here in Pennsylvania, it's about $900, okay? So we're paying that now. It's not free. It's not like you have your insurance and over here, these poor people over here don't have insurance and you're not paying for it. You are right now. Because when they use the emergency room as a primary care physician, you're paying for them. When they get really sick and they treat them because they delay treatment costs a lot of money, you're helping to pay for it, not all of it, you're helping.